MDI, MDI, MDI. Verifies orders.
Okay, let's see here. Looks like the doctor's ordered a MDI treatment for this patient. Okay, let's get this set up.
Maintains a sepsis.
Hi, Mr. Coley, how are you doing?
Doing alright?
Don't mind me, I'm just washing my hands and putting these gloves on.
Okay.
How are you feeling today?
Chest is a little tight.
Okay, feel some tightness in your chest.
Yeah.
Is that common, or is that something that happens here and there?
It just happened
Okay.
recently.
Perfect, okay.
Identifies patient and self.
You mind if I see your wristband real quick?
Yeah, no problem.
Okay, and your birthday?
4789.
And how do you say your full name?
Nicholas Coley.
Perfect, that's the guy I want. Okay,
Explains purpose of procedure.
so basically what we're going to do is we're actually going to use this called a meter dose inhaler. Now what this is going to do is just going to help you relieve some of that constriction that you feel inside of your chest, make you feel a little bit more relaxed. It's a therapeutic method, and that's basically going to help you out. And so what we're going to do is we're going to help you out, just trying to make you feel a little better, breathe a little better. Does that sound like a good idea?
Yeah,
All right,
hopefully
perfect.
it works.
All right.
Positions patient.
What we're going to have you do is just going to have you strip nice and straight. Perfect. And so that just makes you feel a little bit better. Does it hurt at all sitting up straight like that? Okay, perfect. Just making sure. Okay, cool.
Correctly assembles equipment.
So what we're going to do here is we're actually going to have this meter dose coming. Now this might be cold. We're going to warm it with our hands. And what we're doing is we're just kind of just warming the canister, kind of mixing things together, making sure that nothing is settling in there. Okay? So what we're going to do is we're going to put this inside of here, hopefully. How do you do how do you do this thing, son?
Wait. Can we cut this out or something?
You son of a bitch.
Look at that.
Can you trim that back to where it was good? Are you good?
Keep going.
Ready?
And what we're gonna do next is, after you show him, is obtain baseline data. Okay.
So wait a minute, what about this?
No,
Well,
just start over with warming.
You're gonna
and then we'll
quickly,
send this to-
correctly assemble equipment,
Okay.
Alright, so
And what's next after that?
and then next is obtain baseline data.
Okay.
Okay, ready?
warm.
So we're going back.
To warming
I'm gonna say correctly assemble equipment.
Okay.
Correctly assemble equipment.
Okay, so what we're going to do is we're actually going to take this canister, we're going to warm it with our hands at body temperature. We're just trying to kind of get everything going, kind of mix the canister together, okay?
Okay.
And so what we do here is we actually take this, and there might be some extra particles mixed around in there. We're just going to kind of shake it, you know, some people say vigorously. You don't really have to shake it too vigorously. What we're going to do is we're going to prime it, and that's going to get rid of any particles that we have. So basically what we have there, it's just that starting dose. We're trying to get rid of that starting dose, okay? So we're going to put this to the side here. We're going to do something else, okay?
Obtains baseline data.
Okay, so what I'm going to do now is I'm going to get some vital signs. And what this is going to do is this is just going to help us out. This is going to kind of get us a pre and post treatment, okay? So what I need you to do is you put your finger in this pulse ox. And that's going to basically get us a good oxygenation level. Okay, so we got that going. All right. Just kind of remembering everything we have there. Do you mind if I take your pulse, your respirations, and your breath sounds? All right, let's do that then. Okay.
Check pulse for 15 seconds times 4. Listen for breath sounds for 15 seconds times 4.
Okay, so what I'm going to do is I'm going to listen to your breath sounds. It's just going to be just nice deep in and out. Take a couple deep breaths in and out. Perfect. Let's go to that side. Alright. This side here. Go to the other side. One here. One here. Let's just scout that whole back.
Alright.
Okay. How'd that feel?
It's still a little tight.
Yeah, still a little tight, so a little constricted, kind of hurt when you did that?
A little bit.
Okay, perfect. We can actually take your finger outside of that real quick. So So what we're going to do here is this is actually called a peak flow meter. And what this is going to do is this is actually just going to get us an idea of how well you exhale, how much constriction is really there, okay? So what I need you to do is I'm actually going to have you put your hands on this. And what you're going to do is just take a nice, slow, deep inhale in and blow hard as hard as you can, okay?
Just blow as hard as I can.
Basically.
Alright.
All right. So let's go ahead and get 2 more. And what we're
Okay.
going to do is we're going to just try to establish the best of the 3, okay? Consider it a competition. All right. Let's get 1 more, okay?
Okay.
Okay. How'd that feel?
It hurt. Like I said, it's more of like a tight feeling.
Okay, perfect. So we've taken your pulse, we've taken your respirations, we've checked your peak flow, we've taken your pulse ox, we've listened to your breath sounds. So I'm thinking that we're getting ready to start the treatment. Does that sound good to you?
Yeah.
All right, perfect.
Instructs patient.
Okay, so what we're going to do is I'm actually going to give you this, so you're going to be in charge of this.
Hold on to this thing.
You're going to put that MDI about 4 centimeters, 2 fingers right outside your mouth. So we're going to take 2 fingers, just put them right to the edge of your mouth.
Okay.
You're going to open your mouth up.
Alright.
What you're going to do is you're going to take a slow inhale in and an exhale out. And then on your second inhale in, you're going to take a slow exhale in and you're going to press the MDI.
Okay.
And then you're going to close your mouth and hold for about 3 to 5 seconds. And that's basically just going to let the particles settle inside, let the medication be delivered, okay?
Okay.
All right, let's give it a try, okay?
Alright.
All right, so let's take a deep inhale in, mouth open, and out. Open that mouth wide. Here we go. Perfect. Now order here is for 2 puffs, so hold it for about 3 to 5 seconds. All right, now relax. Take a couple deep breaths. We'll give you some time.
Okay.
All right, let's go for that second puff here.
Okay.
All right, you already know what you're doing. In and out, and in. Here we go. Hold and relax it out. How's that feel? It should settle in. We should let some time go by, about 5 minutes, and then it should really start to kind of like take advantage of what it's doing for you.
Okay.
How are you feeling now?
Right now I still feel about the same.
Okay. Give it some time.
Alright.
All right.
Monitors therapy effectiveness.
All right, so some time has gone by. What we're going to do is we're going to check out your vital signs again. We're going
Okay.
to see how everything's going. First and foremost, the most important thing is how do you feel?
I feel a little bit better,
Yeah,
actually.
you feel a little bit more open.
Yeah.
Okay, perfect. Well, let's check and see how everything goes, and we'll see how it goes. All right?
Okay.
Alrighty, so let's go ahead and get your finger in that pulse ox again.
Another thing is...
Yeah. What we're going to do is we're going to just relax. The pulse ox is looking better. Let's check your pulse again. Let's see. This is good. Respiration rates are better. Let's check those breath sounds again.
How'd I sound before? Pretty good?
What's that?
How'd I sound before?
It had a little bit of wheezing, so let's see if that's went away. Take some breath sounds in. There you go. One more. A good one here. Another one here. One here. And one here. Scout the whole back. Keep going. All right.
That was a lot easier to breathe in.
Yeah. Felt better?
Yeah.
Okay, so perfect. So what we have here is we've basically done everything. Everything looks great. We rechecked your respiratory rate, your pulse, your breath sounds, your pulse ox. Now let's just do this peak flow meter, okay? Basically, we had a high of about 600 last time, so it should be better. So let's give it a try, okay?
Alright.
You remember how to do it?
Yep.
All right, let's go.
Like 6.5?
Yeah, all right. Sorry about this table. Let's keep going.
Alright. Just move it back down?
Yeah. All right, that's way better. Let's do one more, okay? That's 1 out of 3.
Okay.
Oh my gosh, that's crazy. It's a completely different person.
Yeah.
All right, so we pretty much finished everything. How does everything feel?
I feel a lot better.
Okay, yeah. Any questions for me?
No.
Maintains equipment, cleans MDI.
Okay. Well, perfect. Well, what I'm going to do is I'm actually going to clean this out for you, okay? And
Okay.
you can just take an alcohol rub, and we can actually clean this out. It's just real simple. I mean, just come in here, wipe, clean, perfect, okay? Have any questions for me or anything?
No.
Okay. All right.
Records information in patient record.
Well, Well, I'm gonna go, okay? I gotta go ahead and record in your chart exactly what goes on, okay?
Alright.
Alright.
If I think of anything, I'll ask you.
Yeah, if you have any questions or anything, let me know. I'll be around to check your treatments out. We'll obviously probably do this again, okay?
Yeah.
I don't know what's going on with this table, man, but we'll get this fixed, man. I don't know.
Alright.
So what I'm doing now is I'm recording all the patient information. We started at about 16:29 and we're ending about 16:35. Checked all his pulse, respirations, and his breath sounds. Everything sounds normal after sounding a little wheezy the first time. His pulse is a little bit better, his respirations are a little bit slower, and he's saying that he can feel a little bit better while he's breathing. Clearly the patient was learning, he did everything great, didn't require a chamber, although a chamber may be required with young children. If you have any more questions, you can ask Son about anything else. Thank you. Goodbye.